had. We're one of the early adopters of 3D technology, and about a year and a half ago we were able to justify making a very heavy investment in it, and we are so glad. And my sons and I, we put on seminars to teach other doctors how to use the technology, and some of my colleagues now are calling me up and asking me questions because they're thinking of adopting the technology as well.
I think when the technology bubble hit in the 90s, he was one of the first to have a website back in the day when no one had a website. So he's definitely an innovator. And now we just got a 3D CBCT cone beam machine from Kodak, and it is probably one of the most advanced machines in the county. We can take 3D images of all of our patients, and it definitely helps with canine impactions and diagnosis of eruption of teeth.
Being able to be an innovative person and have this technology and use it makes the whole treatment not only a success, but an easier way to get it done. We're able to locate and find things on people's cases that you would never find with conventional 2D imaging. One of the things with the 3D imaging is that we can actually take the entire skull and look at it in a three-dimensional plane, whereas before it was, flat on a piece of paper or on an X-ray.
I think where dentistry was and where orthodontics, was, and some practitioners, which I'm sure they're great practitioners, they give a standard of care. We like to just take it a step further and go beyond that standard of care and add the technology, the patient interaction, their ability to see what's going on within their mouth with the 3D cone beam. It makes it so much easier to communicate with the patient. And it's in an information age that we live in, the patient has to be informed completely of their treatment. And what better way to do that than to show them a 3D image of their entire dentition, and so they can see exactly what we're seeing, and they can definitely see what we're diagnosing. So patient knowledge is key to giving complete patient care.
Discover the problem as we go. And so it has decreased treatment time in many cases. It's increased treatment time in some cases because we find something that we might not have addressed in a 2D environment. Within 10 minutes, we will have the digital rendering up on a high-resolution monitor, and I always open it up so the parent can see it. We can turn the head around and look at things, and as we're turning the head around, we're showing the mother, where the wisdom teeth are, the anatomical structures that we see. We show her where the problems are, and it's so obvious on the high-resolution monitor. They understand from a picture's worth 1,000 words, rather than giving them a long written letter with all these big words in it. We have monitors at every chair where we can show patients what they look like and what we're doing for them.
I think with the iPhone app that we came out with, I think it's really a great way to move the technology forward as far as patient education goes. And also our website, I think, is another great source of information for people. I feel like the more that the patients know, the better off they're going to be.
There's certain doctors who like to extract teeth. It tends to make the procedure go a lot smoother, but there's a lot of things you have to take into consideration when extracting teeth. Soft tissue profile, TMJ problems, developing some kind of jaw pain in the future. So those things have not proven to be attributed to extractions, but people always need to be aware of that. And also, no one wants to lose perfectly good teeth, so we try and save as much of the natural dentition as possible.
We don't like anybody to have to go through that. Unfortunately, some cases do require it. But I like that my father, having been in practice for 39 years now, has developed through the golden age of orthodontics and figured out that pulling teeth immediately on every case is not always the best option. I'd say if somebody went somewhere and they said that immediately, I would get a second opinion. It's something that in a lot of cases can be avoided, and being able to learn from my father when and where is, I think, one of the best things about working here, and learning from one of the masters is it's not just a book. You get to learn hands-on from him every day. It's wonderful.
It is very rewarding, especially whenever you see someone who's really self-conscious about their smile, and you see how it affects their overall attitude and just how they carry themselves. And so to see somebody come in, that's very self-conscious, and then to be able to provide them a service where at the end you can see the difference in their personality.
Well, I started coming to work with my father when I was about 10 years old, and basically would hang out in the back of the office, sterilize instruments, make impressions. By the time I was about 14 years old, I was comfortable enough to start working a little bit with patients and just feeling my way around the office and kind of making it home for myself in a way. I really enjoyed it. I always have. When I was 18, I actually went off to college and got an engineering degree at Full Sail University, and used that for about 2 years and realized that the family business was where I really wanted to be. This office is my home. This is where I belong, and working with my father has been a wonderful experience, and it's great that he and I can now discuss cases and chit-chat back and forth on how we would treat certain aspects of a case. And working with our patients is great. I like that they feel like it's a homely environment, and I think, to me, that's one of the best parts of this career.
Always as a child, I hung out with my dad in his office. I used to help with sterilization. I'd help with all facets involved in his practice. I especially enjoyed seeing him just work with kids. You know, it's a great environment to work in. Every patient leaves here, they have a beautiful smile, and it's really a great thing. It's a blessed profession. To be in this profession, you actually change people's lives.
Like, I've been to my other friends' orthodontists, and it's nothing like this office. It's beautiful here and just so open, and everyone's so welcoming, and it's like a warm environment. I definitely smile a lot more now without having braces and with having a better smile, because my teeth before weren't that great, and now that I have like a perfect smile, I want to smile all the time. I
went to dental school in San Francisco, so it definitely wasn't a bad place to go to school. It was definitely a beautiful city. Just really a lot of life experiences. Definitely found the rewarding side of dentistry in San Francisco. We treated a lot of the indigent people, people with complex health histories and such. So definitely got to see a large, diverse patient group, and it was really rewarding. Well, I think our practice and our family is centered around patient care, and also the patient experience. We want them to have a positive experience when they come to our office. And if you just look at our office and the atmosphere that we bring, the people that work for us, everybody loves to be here and loves to be treated by our family. And so that's what we draw in the community, is that need to be treated like family in a dental or orthodontic practice.
Well, the first thing every person notices when they are introduced to anyone is their smile. So you don't ever want to have that insecurity when introducing yourself. You want to have a great smile, and that was something I wanted to look forward to in my future with my career, my job, and I knew even back when I was 13 that I wanted to be in dental. So it kind of worked out perfect for me. I knew that this is what I wanted to do, and I didn't want to have to introduce myself and be insecure about my smile. Every person, every family that comes in here, they're aware of who works on them, and we have several offices. In each office, they see the same faces. It's not they come to one office and then they come and visit this one and it's a whole other group of people. We get to grow with these patients and see them from point A to point B and how they change in the year, whatever it is, and it's nice.
I absolutely plan on being here for as long as they'll have me. I have to say, when I first came here, I was just so thrilled. I couldn't even believe, I mean, not only, like I mentioned before, the technology, it just makes this place so much more exciting. Of course, the beautiful view, which is nice and tranquil for the patients as well, but the entire atmosphere is wonderful here, you know.
I got my braces here 9 years ago, and now I work here. What else can you ask for?
And that's what we want. We want every patient to have an experience that they'll remember for a lifetime. And most of the time, you know, when a kid comes into ortho, we want it to be fun. We don't want it to feel like a dental office where they're getting, you know, a shot or anything like that. We want it to be a very calm environment for the patient. And if you look at our views of the river and, you know, the people that have been working for us, you know, you see that this is a practice that's oriented around patient care and about the patient having a great experience.
What I really want to do is follow in his footsteps and continue on that legacy of technology and advancing this wonderful profession.